Hi, I'm Dr. Greg Relo with Express Dentist. Patients come to the office with many different questions and many different ideas, and some of them are right on the spot, and others are just a little bit off. So, today, what I want to do is just look at 5 myths that surround dental health that you may or may not believe, but hopefully, once we've gone through these, they'll help you understand your dental health just a little bit more. So, the first myth is that sugar is the only thing that can cause cavities. And, sugar, simple carbohydrates are really this fuel source for the bacteria that cause cavities. Those bacteria take that energy source in and they make an acid as a waste product. That acid is what actually dissolves your teeth. So what they need is energy, and simple sugar is definitely their number one choice. But anything that's a simple carbohydrate works. So that means that anything like corn syrup or crackers, anything like sticky fruits, fruit juices, fructose, all of those other forms of sugar certainly can cause cavities by giving those bacteria an energy source. So when we're dealing with a cavity problem, we definitely want to look at sugar intake in the diet, and we don't want to just think of candy or soda, which obviously is a big problem, but we're also looking at other things as well, like all of those snacks and even breakfast cereals. If you look at how much sugar they have in them, that can be a very significant source as well, and often in various forms. Second myth that we hear is that you only need to visit the dentist if you have a problem. It's a good time to visit the dentist if you have a problem, for sure, because it's probably the only way that you're going to get a real definitive solution to that problem. But prevention is always the best medicine, especially true in dentistry, because little problems become big problems, and most dental problems don't hurt until they reach a fairly significant critical stage. And so it's always good to go to the dentist and have things checked out before they become a problem, before you have something that's talking to you. And so those checkups are really very valuable. Another myth we hear, number 3, is that brushing harder means cleaner teeth. So remember, we're not scrubbing the sink with our toothbrush. We're gently cleaning away soft plaque that is sticky. It's on the teeth and it needs to be removed mechanically, but we don't want to over scrub, because your teeth are, as we mentioned, this mineral surface, and it can actually cause an abrasion along with an erosion of that mineral and slowly wear it away over time. Furthermore, your gums around your teeth are very thin and relatively fragile. And if you're scrubbing on them, that can definitely cause the same type of problem where it's actually eroding, in a sense, that gum tissue and causing recession. And that can be repaired, but that often then means a surgical problem. And it's usually precipitated by sensitivity and even possibly decay on those softer root surfaces. So that's definitely something we want to be aware of. Another myth that I've heard sometimes is that chewing gum is a good substitute for brushing your teeth. There is no substitute for brushing your teeth. That sticky plaque that we were talking about, it must be mechanically removed. And if it's not, it's going to eventually lead to some type of gum disease, even mild forms like gingivitis, or more severe forms like periodontitis, which is bone loss. And chewing gum can certainly, help with stimulating saliva flow, but there's a couple things about that. You want to be careful that it's never a sugared gum. It needs to be a sugarless gum, and ideally with xylitol in it, which is a very good natural sweetener that is anti-cavity. But we also want to make sure that that gum chewing isn't just seen as a substitute because we're stimulating saliva or giving our teeth a sense that something's happening, because it's just not. There is no substitute for brushing and flossing. And number 5 is a myth that I hear a lot: tooth loss is inevitable. It runs in my family. There's certainly some genetic links to oral health, for sure. But tooth loss is not inevitable. Really, there are very few people in the population who would say absolutely there's no way that we can stop it. Gum disease is not curable, and it is the most common way people lose their teeth, but it's absolutely controllable in 99% of the cases. It can take a lot of effort and a lot of diligence, but tooth loss is not inevitable. And there's no reason why most people shouldn't maintain all or most of their teeth for their entire life if they have the right habits and they get the checkups that they need and the treatment that they need along the way. So at Express Dentists, we have a trusted network of dentists around the country. And if you have a myth you want to explore a little more, you just need some more information, you need a checkup, you need a cleaning, go ahead and give us a call and let us know what you're looking for, and we can help connect you with a dentist in our network. And that can help you get set up with somebody that you can go in and see on a regular basis, or if you have an emergency. And so if you learn more about your oral health and you go in and do the preventive steps that you need to do along the way, you should enjoy good dental health for the rest of your life.